Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. How are you?
Well, you know, I'm living it up. I hope you are too, and I hope everybody else is listening to the show.
Doing my best. And we would like our listeners to live it up. So if you're experiencing chronic musculoskeletal pain, you want to call us during the hour so you can talk to Dr. Darrow about your pain. And you want to get his latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies. You can also see videos of the treatments being performed on his website at www.lastemcells.com. That's lastemcells.com. And you can email Dr. Darrow off of every page on that website. Again, www.lastemcells.com. But you really want that free book. It tells it all. I have a copy sitting here with me right now. Our number again for getting your book is 866-870-5752.
Thank you, Nita.
You're
Wonderful.
welcome.
Well, I think I'm going to go to a question which will weave in what regenerative medicine is all about and how you can heal your orthopedic injuries and arthritis. So let's see this one. This is good. Severe arthritis in my right thumb. Thank God that's not me, right?
How do you golf if you can't use your right thumb? Hello.
People do it. They get, nothing stops golfers, I promise you that. It's an addiction. It's one of the best addictions because you get to get out and exercise and walk around in the park and use some intelligence in how you hit shots. I think I may go play today, Nita. You don't mind, do you?
No, one of these days I'm going to join you because I'd really like to learn. It's been a secret desire inside me for many years. Yes.
You never mentioned that. I'll take you to the range. You know what the driving range is, right?
Yeah, that's where you'll start to learn, right?
Yeah. I'll have you up hitting the ball within about 10 minutes, I promise.
Oh, cool. I'm excited.
I'm probably the best teacher and the worst player on the planet. What's that statement about those who blah, 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 can't do, teach, blah, blah, blah?
Yeah, something like that.
Because I've had so many lessons that I'm very tuned in to what the swing is about. I can see it in other people, but I just can't do it. That's the story with most golfers. They can all teach it to other people, but they can't play that great.
That's hilarious.
Anyway, this person says, I have severe arthritis in my right thumb. I'm interested in stem cell treatment before I consider surgery. I'd like to set up a consult with Dr. Darrow. That's me. Yeah. Why would you jump to surgery when you can get a simple injection to help heal what your problem is? Anything in the musculoskeletal system, well, I can't say anything. We have to choose our patients wisely. If we take someone and we think they're not going to heal, obviously I'm not going to inject them. And regenerative medicine is all about what the word is, regenerating tissue in the body. So typically arthritis is, at least some types of arthritis, because there's a lot of different types, is a syndrome of the cartilage between the bones wearing down. There are also other types such as inflammatory arthritis, like rheumatoid arthritis or psoriatic arthritis, that are inflammatory in nature. And instead of wearing down the cartilage, which can happen with an injury or just overuse with a sport or something else, a lot of people with thumb arthritis are postal workers, guys that are handling mail. They're flipping envelopes all day long. So that's just overuse. With the inflammatory arthritis, it's more of something that is autoimmune usually, where there are antibodies in the blood that actually attack their own person's tissue. So that could be anywhere around the body, but especially the joints. So this person has severe arthritis in the right thumb. They'd like to consider stem cells before considering surgery. That's wise because I see way too many surgeries being done that fail. People come into me after their failed surgeries, and from different studies I've read and from my own observations in the last 25 years or so, I see that way too many surgeries fail. I'm going to say in musculoskeletal, orthopedics, about half of them, if they don't fail right away, they fail down the road because typically they're taking out tissue and destabilizing the joint. That's not a good thing. Why not just regrow the tissue and rejuvenate it and heal it? That's what I do. And we use platelets from the blood. That's called PRP, platelet-rich plasma, or we can use stem cells. And the stem cells are typically mixed with platelets. So if we're taking bone marrow, which we get from the back of the pelvis at a place called the PSIS, and by the way, when I throw terms out like that, you can write them down and go to Google, find the term, and then in the upper left-hand corner, there's a spot that says images, and you can take an actual look at the anatomy and see what I'm talking about so you can educate yourself. And what I like to do is have my patients educate their doctors also, because I'm going to say it like this. Traditional doctors, and this is not a statement against them, it's just the truth, are pretty much dinosaurs. They get trained in medical school, and then they stick with that training, and they don't go further, because that's the tradition, and people love to follow tradition. Humans love tradition. Personally, I'm not a tradition kind of guy. I want to push the limits, and in medicine, I like to find things that work naturally. I don't like using medicines. I don't like using surgery. There are times, obviously, when surgery is mandatory. I had a surgery to remove my adrenal gland on the right side because it had a cancer. It was called a pheochromocytoma. Try to write that one down. Nita, can you even repeat it?
Phrema chromosomal, and the cow jumped over the moon.
Yeah, anyway, it was a neuroendocrine type of growth, and it was producing high adrenaline in my body, so my blood pressure was shooting up to like 250 over 150. A lot of people that have this die without the doctor even knowing what it was. They have what we call labile hypertension, where their blood pressure just jumps around. I had that. So the tumor was removed. That was a necessary surgery. But if you have something like arthritis, if you have a meniscal tear in your knee, rotator cuff tear in your shoulder, my point of view is do not get a surgery for that. You're removing good tissue. If you have a doctor that's willing to put in writing that he's not going to take tissue out and maybe just sew up the meniscus, that may not be a bad thing. If you have a big flap tear and you can't bend your knee, you might need a surgery. But that's really kind of rare from what I see. Most people come in, and let's talk about thumb arthritis. They go, I've talked to 3 different orthopedic surgeons, hand surgeons. They all want to do surgery to put in a prosthesis, meaning a fake joint. And when I have people come in after those surgeries, they often do not do well at all. And they can have more pain than they had before the surgery. So what I do is I take either platelets from the blood or platelets and stem cells from bone marrow, which is a very simple procedure. And it's literally like taking bone marrow is like drawing blood. It's just taken from the pelvis. It's very quick. It's pretty painless. And we numb up the area. It's not like doing a bone marrow transplant where people say, wow, that was really painful. This is just a small amount of marrow that's taken out. And sometimes we have to spin it in a centrifuge, especially if it's going into a knee, because the red cells are very inflammatory and they can cause a knee effusion. That means the synovial tissue gets irritated and produces a lot of excess fluid, and that hurts. So we will spin that, take the red cells out, and then inject that. But most places in the body, we don't even need to spin it. There are many studies, and I've done one comparing bone marrow which is spun versus unspun, and they both work the same. We just have to be careful that we're not sticking it into a knee. So I do thumbs almost every day. I just did one yesterday. The person said before I injected, how often do you do these? And I said, we do these pretty much every day. It's very, very common to do thumbs. People have a lot of thumb arthritis. That's very, very common. And the fingers from overuse. I get a lot of guitar players, musicians, violinists, bass players, you name it. And they typically are going to wear out their hands from overuse. And we get very, very good success with that. So I'm going to give out the phone number now so we can get some callers in if you want to get your pencil.
We have Alan waiting for you, too.
I don't see him on my call screener, but hang on, Alan.
Okay.
Maybe my call screener is not working here. Strange. Let me see what's up. There he goes. He just popped up there. But let me give out the phone number, Alan. Just hang with us. The number to the studio is 866-870-5752. I'm going to repeat it one more time. 866-870-5752. And if you want to catch me at the office or get more information than we give you on the radio show today, you can call the office at 800-300-9300. But if you do call the studio right now, I'm going to give you a free copy of my stem cell and platelet book called Regenerate, Don't Operate. And as Nita said before, it's got about 265 studies on regenerative medicine, how it works, and how surgery often can fail. And it's got a lot of photos of me doing injections. There's a beautiful photo of Suzanne Summers in here, who wrote the introduction. Thank you, Suzanne Summers. She wrote the foreword. And she also wrote a book, her latest book called A New Way to Age. And on page 302, there's an entire chapter about me and regenerative medicine and how it's helped her and her family. I've been treating them for many years. So God bless you, Suzanne Summer. We love you. So we're going to go to Alan. You have left knee pain, apparently. Which knee is it, your left or your right?
Hey, Alan, are you there?
Yes.
Is it your left knee or right knee that bothers you?
My left knee.
Okay. And are you right-handed or left-handed?
I'm left-handed.
Okay. So that's your dominant hand and probably your dominant knee. And what do you think caused your knee pain?
I was at a bus stop and the platform was too low and I jumped onto the platform.
Okay.
This was about 4 years ago.
Okay.
And it hurt my knee.
Okay.
I wanted to know if stem cells or PRP can cause infection in the joint.
Anything can cause infection if you put it into a joint and it has an infectious material in it. So joints can get an infection without injection. Some people wake up in the morning with an infected knee or shoulder, and they don't know even how it happened. It can be done what we call hematogenously. The blood can have an infection in it and go to a joint and end up there. So it's not that injecting these things causes infections. It does not. I have never had an infection. I've been doing this for almost 25 years. I do it all day long. I inject joints. I have never infected a joint. We use hospital-type surgical priorities to clean the area. We use betadine, which is an iodine preparation first, and then we use something even stronger that is chlorhexidine. So we're very fastidious about keeping the area sterile before we inject. We have never had an infection. Does that answer your question, or do you have more about that you're concerned with?
That answers my question, but I have another question.
Sure.
Can stem cells do they cause inflammation, and what happens to the area?
That's a great question. I don't think anyone's ever asked me that before in all these years I've been doing it. When we inject bone marrow generally has inflammatory things in it and anti-inflammatory things in it. Stem cells generally are anti-inflammatory. So, for example, I don't do IV stem cells, but there are a lot of doctors who do. They fly under the radar and do that. And out of the country, there's not really an issue doing it. And what they find is people that have diseases that cause inflammation in the body, the inflammation is quieted down for about a week or so. So that's with stem cells. That's not bone marrow. If I'm going to inject bone marrow into a joint, there is a short inflammatory period, and that helps healing. So people go, why do you want to inflame it when it's already inflamed? And the reason for that is when your body is injured or has arthritis, there is inflammation as part of that syndrome. But it's a low level of inflammation. It hurts, but it's a low level. When we do these injections, platelets or platelets with stem cells, we do cause a short inflammatory cycle, but that extra inflammation brings fibroblasts to the area. So I'm going to give you an analogous situation. If someone sprains their ankle, which is so common, most of my patients, when I ask them, have you ever sprained an ankle? Almost everybody goes, of course I have. And I go, how'd it feel? They go, terrible. It swelled up and it hurt. And some people say it just took a few days to get better. A lot of people say if it's a bad sprain, they go, it took like 6 to 8 weeks. So that's a lot of inflammation. Why do those heal alone without surgery or without anything else? Because it's sort of God's way or the body's way to heal. The inflammation actually does some healing. But if you're chronically inflamed, that's not a good thing. So when we do these procedures of regenerative medicine of platelets or stem cells, or a combination, we are creating a short burst of inflammation to bring fibroblasts. And fibroblasts are the cells that grow collagen. Collagen is the major constituent in our tendons, ligaments, and cartilage. So we like to have that inflammation for a short period of time. Typically, when I inject somebody, they're going to be stiff for about 24 hours. And that's been my experience on my body. I have injected, personally, I've done my own, I do it myself. I've done my own knees, my own shoulders. What else have I done? I've done both my elbows and my right wrist. I've had other doctors inject my neck and back because although I don't want them to, I'd rather do it myself. I can't reach back there. I trust myself more than I trust other doctors because I've been told I do the most of this of anybody on the planet, so I feel like I'm pretty good at it. Maybe I'm not the best, but I have a lot of experience in it, and I trust myself. So I do my own injections whenever I can. By the way, Alan, what did your doctor tell you about your knee?
I haven't visited it. Actually, he gave me a brace.
Okay.
And it felt better for a while.
Okay.
But then during the summer, I walked a little too much. And I guess it started to hurt again, you know.
Okay. Well, at least you didn't have a surgery because that would be the wrong way to getting to a healing. Surgery should be saved either for emergencies or for a last-ditch effort after you've tried everything else. Because you asked about infection from stem cells. I see a lot of people who get infected from surgery. That's common.
Mm-hmm.
Because it's invasive.
Can a person walk after the injection?
Absolutely.
After
Absolutely. People drive themselves. No, they can walk right away. People drive themselves to the office, and then they drive themselves home. And they can walk to their car and all of that, even if it's a knee that we're injecting or a foot or an ankle. I don't want them to be... I'm sorry, go.
Exercise after the shot, right?
Well, it depends who it is. If it's a pro athlete, you can't stop them. If it's me, you can't stop me. But the typical patient, if they want to get the best healing they can get, they're going to let it rest for a while and let the tissue start growing in. Yeah.
Mm-hmm.
And I have a lot of patients just go, I'm not going to rest it. I work out all day. That's what I do. And I go, fine. You're not going to heal as fast as someone arrested. And they go, I don't care. I just want to get this going. I want to get the healing started. And I don't mind coming back more often to get it done, but I will exercise. And I accept them as patients. I just let them know that it is problematic.
I go to a program, and we have groups there, and I just go and sit down, and then I go to the restroom sometimes, but it's not a lot of walking.
No, you're fine. Yeah, you're totally fine doing that. No problem.
I see. I can walk a maximum of about a half a block, and then it starts to hurt.
Okay.
You think I'm a candidate for stem cells for that?
The fact that you can move your knee, you're walking, is a pretty good indication that I can help you get better. If we have a joint that's completely arthritic to the point where it really is what we call bone on bone, not just what doctors call bone on bone, because I get probably half my patients with arthritis say they have bone on bone and they do not. It's a It's a buzzword that means I want to give you surgery by the doctor. So I would say 99% or more of the patients that I see that have bone on bone do not have bone on bone. They were just told they have that. They have a joint that can move, which means it's not bone on bone. Bone on bone, to me, means that there's no cartilage there and the joint doesn't move. Bones are like bricks in a way. They're porous, and if there's no cartilage on top of them to allow them to slide and to move, then that's bone on bone. But I don't see that very often. I see that very, very rarely, actually. So I think you're a good candidate just talking to you, but like I tell everybody else, I've got to examine you to let you know if you're a good candidate.
I see.
There's a lot of variables that don't show up just talking to someone. We need to talk first, obviously. We do the history, a very complete history, and then I do the examination to figure out what's really going on. And, a catch to this thing is a lot of people have MRIs or X-rays that show things that the surgeon says, look at that, we have to operate. And then I take a look at the MRI or X-ray, and I go, yep, that looks bad. And I do the examination, and I go, but your joint or whatever it is, your tendons, your ligaments are good. And they go, what do you mean they're good? I go, they're functional. So don't believe the MRI or the X-ray. You've got to do the exam. Way too many of my patients come in after a failed surgery. That means a surgery was done, it didn't work out, they got worse, or they didn't get any better. And I say, did the surgeon ever touch your body? And they go, no, they showed me the MRI or the X-ray. That's not a good way to practice medicine to me.
Mm-hmm.
It's just kind of the culture that we're in, which is look at the image and figure out if you need surgery. That's not good medicine to me.
So when the joint is stiff for 24 hours, it usually goes away, the inflammation?
Yeah, it's just a short burst of inflammation.
And then I can walk on it, but not do exercise, just where I have to go.
Well, I think the first thing, before I give you definitive information, Alan, is come in the office. The phone number to the office, if you want to come in now, there's people there, is 800-300-9300. Come on in for a history and physical. Let me check you out and give you some real information rather than just hypotheses based on what you're telling me right now.
Mm-hmm. Okay. Thank you, doctor.
God bless you, Alan. I think there's real good hope for your healing.
Thank you. Bye-bye.
All right, so the phone number to the studio for any of you that want to talk to me live right now is 866-870-5752. That's 866-870-5752. And if you want to email me, you can do that by going to my website, which is www.lastemcells.com. That's lastemcells.com. We're going to the break, and hopefully we get some callers after the break. we're going to give you a free copy of my book, Stem Cell and Platelet Therapy.
Sounds great. Thank you, Dr. Darrow. You're listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil. Write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.